Hello everyone, thank you for joining me today. In this video, I'm going to explain what radiology is, its different imaging modalities, and why it is so important in the medical field. Radiology is a branch of medical science that allows us to see inside the human body using different imaging techniques. It helps doctors understand what is happening inside without needing surgery. With radiology, we can detect diseases early, plan accurate treatments, and monitor how well a patient is recovering. In simple words, radiology helps doctors see what the eyes cannot see. The first and most common imaging technique is the X-ray. X-rays are widely used to check bone fractures, chest infections, lung diseases, and dental issues. For example, if a person falls and hurts their arm, the quickest way to know if the bone is broken is through an X-ray. It is fast, simple, and inexpensive. The second modality is ultrasound, also called sonography. Ultrasound uses sound waves instead of radiation, so it is very safe and widely used during pregnancy to check the baby's growth. It is also used for abdomen, pelvis, thyroid, kidney, and soft tissue scans. An example is using Doppler ultrasound to check blood flow in veins and arteries. The next modality is the CT scan, also known as computed tomography. CT combines X-rays with computer processing to produce cross-sectional, 3D-like images of the body. CT scans are extremely important in emergencies. For example, if a patient comes with a head injury, CT immediately shows if there is bleeding inside the brain. It is also helpful for lung diseases, cancers, internal injuries, and stones. Another major modality is MRI, which stands for magnetic resonance imaging. MRI uses strong magnets and radio waves, not radiation. It gives very detailed images of the brain, spine, joints, ligaments, and soft tissues. For example, if someone has a slipped disc or knee ligament tear, MRI shows it clearly. It is one of the most detailed imaging techniques in radiology. Mammography is another important modality. It is a special type of X-ray used to examine breast tissue. Mammography helps detect breast cancer at a very early stage, sometimes even before symptoms appear. That is why it is recommended for women, especially above the age of 40. Next is nuclear medicine and PET scans. These use small amounts of radioactive tracers to show how organs are functioning, not just how they look. It is very useful in cancer detection, cancer staging, thyroid problems, heart function, and checking how well organs are working. For example, PET scans help identify if cancer has spread to other parts of the body. Another fast-growing area in radiology is interventional radiology. This involves performing minimally invasive procedures using imaging guidance such as ultrasound, CT, or fluoroscopy. Examples include taking biopsies, draining fluid from infections, placing stents, opening blocked blood vessels, and treating internal bleeding without major surgery. Interventional radiology helps reduce recovery time and avoids big surgical cuts. Radiology is extremely important in the medical field because it helps in early diagnosis. It allows doctors to detect diseases at an early stage when treatment is easier and more successful. It plays a major role in emergency medicine, especially in trauma cases, stroke, heart attacks, and internal bleeding. Radiology guides surgeons, helps plan treatments for cancers, infections, fractures, and many other conditions. It also helps monitor how well treatments are working, such as checking if a tumor is shrinking after therapy. In simple terms, modern healthcare cannot function without radiology. It saves time, reduces risk, improves accuracy, and ultimately saves lives. Thank you for watching this video. I hope this explanation helped you understand radiology, its major modalities, and its importance in the medical field. If you found this helpful, please continue to support and stay connected for more medical learning content.